Welcome to our channel Spoon Feeding Dentistry. Today let's learn about surgical anatomy of thyroid gland.
Thyroid gland is present in neck. It is enclosed by pretracheal fascia, which is a part of deep cervical fascia, and it has right and left lobes joined by isthmus in front of second, third and fourth tracheal rings. Thyroid gland weighs 20 to 25 grams. Its projection from isthmus on left side is called pyramidal lobe, which is attached to hyoid bone by a fibrous band or muscle fibers called levator glandulae thyroideae. These are some pictures showing thyroid gland location. Suspensory ligament of Berry or Berry's ligament is ligament of thyroid gland, passes from thyroid gland to trachea, is a pair of strong condensed connective tissue, binds gland firmly to each side of cricoid cartilage. Let's see some of the pictures and illustrations of suspensory ligament of Berry. Pretracheal fascia is a part of deep cervical fascia, splits to invest gland, and helps in thyroid moving along with deglutition.
Development of thyroid gland. Median downgrowth of a column of cells from pharyngeal floor between first and second pharyngeal pouches. By 6 weeks, central column becomes thyroglossal duct and gets reabsorbed. Duct bifurcates to form thyroid lobes. Let's learn about arterial supply of thyroid gland. Superior thyroid artery is a branch of external carotid artery. It enters upper pole of gland and divides into anterior and posterior branches. Then anastomoses with ascending branch of inferior thyroid artery. Inferior thyroid artery, a branch of thyrocervical trunk, enters posteriorly to gland. It supplies gland by dividing into 4 to 5 branches and enters at various levels. Thyroidea artery is a branch of brachiocephalic trunk, or direct branch of arch of aorta. Enters lower part of isthmus in 2 to 3% of cases. Let's learn about venous drainage of thyroid gland. Superior thyroid vein. It drains into the upper pole of the gland. It enters into internal jugular vein, then follows artery. Middle thyroid vein is a single, short, and wide vein. It drains into internal jugular vein. Inferior thyroid vein, it forms plexus, those drain into innominate vein, but not accompany artery. Cocker's vein, it rarely found between middle and inferior thyroid vein. Let's learn about nerves in relationship with thyroid gland. External laryngeal nerve is a superior laryngeal nerve from vagus that separates at skull base and divides into large internal laryngeal nerve and small external laryngeal nerve. Superior Laryngeal nerve serves as sensory to larynx. Small external laryngeal nerve. It runs close to superior thyroid vessels. It supplies cricothyroid muscle. That is a tensor of vocal cord. It serves as a sensory to upper half of larynx. External laryngeal nerve. It is present away from vessels near upper pole. So in thyroidectomy, upper pedicle should be ligated close to thyroid. Recurrent laryngeal nerve is a branch of vagus nerve. It hooks around ligamentum arteriosum on left and subclavian artery on right. It runs in tracheoesophageal groove near posteromedial surface. It presents close to the gland and lies between branches of inferior thyroid artery. Lymphatic drainage of thyroid gland. Subcapsular lymphatic plexus. It drains into pretracheal and prelaryngeal lymph nodes, and ultimately into lower deep cervical and mediastinal lymph nodes. Physiology of thyroid gland. Dietary requirement of iodine is 100 to 200 micrograms per day. Sources of iodine are milk, dairy products, seafood, example fish. Hormones secreted by thyroid gland are triiodothyronine, T3, and thyroxine, T4. Steps involved in synthesis of these hormones. Iodide trapping. Oxidation of iodide to inorganic iodine. Formation of iodotyrosines. Coupling reactions. Let's learn each other in detail. Iodide trapping from blood into thyroid. Thiocyanates and perchlorates are inhibitors of this step. Oxidation of iodide to inorganic iodine by enzyme peroxidase. Inhibitors are sulfonamide, para-aminosalicylic acid, carbimazole, propylthiouracil, thioamides. Formation of iodotyrosines. Iodine and tyrosine combines and forms monoiodotyrosine and diodotyrosine. Inhibitors are thiourea group of drugs, that is carbimazole. Coupling reactions. Coupling of two molecules of diodotyrosine gives T4 and coupling of monoiodotyrosine gives T3. Inhibitor is carbimazole. Hormones combine with globulin gives colloid thyroglobulin. These hormones stores in thyroid gland and releases when required. T3 is fast-acting for few hours. T4 is slow-acting hormone, that is it takes 4 to 14 days to act. Thyroid function tests are most commonly to diagnose T3 and T4 estimation. To estimate serum T3, serum T4, serum TSH, serum creatinine, serum cholesterol, serum calcitonin, thyroid autoantibody levels. The normal levels of serum T3, serum T4. The normal levels of serum TSH. The levels of serum creatinine increases in hypothyroidism and decreases in hypothyroidism. Serum cholesterol increases in hypothyroidism and decreases in hypothyroidism. That is opposite of serum creatinine. Serum calcitonin, its function is to decrease calcium levels. Diagnosis, it increases in medullary carcinoma thyroid. Thyroid autoantibody levels more than 90% patients has Hashimoto's thyroiditis and 80% of Graves' disease have antibodies called antimicrosomal antibodies. Detecting these helps diagnosis and to suspect these before clinical manifestation. Thyroid scintigraphy is a thyroid scan. It is a diagnostic nuclear medicine test that provides information about structure and function of thyroid. The nuclear medicine physician is able to see size, shape, function, and position of thyroid gland. Like, follow, subscribe, share, comment. Consider these guys.